Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Hello, my name is Dr. Chul Kim. I'm an assistant professor of medicine at Georgetown University. I'm a thoracic medical oncologist. It is my honor to be invited. I'm going to discuss first-line treatment for advanced EGFR-mutant non-small cell lung cancer. These are my disclosures. So epidermal growth factor receptor, called EGFR, is a protein that is present in the membrane of many of our cells. Normal EGFR proteins can get activated upon binding to certain proteins called receptor-specific ligands. However, mutated forms of EGFR resulting from mutations in the EGFR gene can be constantly active without binding to receptor-specific ligands, contributing to cell proliferation, survival, metastasis. EGFR mutations are one of the most common forms of genomic alterations in non-small cell lung cancer. In this large case series of patients with lung adenocarcinoma, using next-generation sequencing, the investigators identified the rate of EGFR sensitive mutations being 19.4 months. There are other types of EGFR mutations, such as EGFR exon 20 insertion mutations that I'll touch upon later. So EGFR mutant non-small cell lung cancer is a poster child for targeted therapy. There are different types of EGFR mutations, as I mentioned. However, there are two most common forms of EGFR mutations. They are EGFR exon 19 deletion mutation and also exon 21 L858R mutation. They account for about 85% of cases. There is geographic and ethnic variation in terms of the rate of EGFR mutations. The rate of EGFR mutation in Asians is up to 40 to 50%, in Caucasians 10 to 20%.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.